to my channel. My name is Stefania, and if you are new here, welcome, and don't forget to like and subscribe. Today's video is a little bit about what I do as a circulator. I'm mainly talking to the nursing students, or if you're a nurse and you just kind of want to change from the department that you're in, I would highly recommend being a circulator. Right now, I am a circulator in ortho spine. So I mainly do a lot of spine cases. So the process of becoming a circulator, not every hospital has what's called a periop program, a perioperative program. Now, if your hospital offers it, it's usually a couple months long, where you learn the skills of being a circulator, and after a couple months, then they start allowing you to observe other circulators within different departments in the operating room. So we got a chance to look at some neuro cases, which are mainly spine, craniotomies, brain, or you can also go to women's and children and observe some surgeries there. And there's just a lot of different departments that they let you explore to see where you would like to work once you're done with the program. The final step is to take an exam, and they usually give you a study guide to help you prepare for the exam. And it's a really straightforward exam because throughout the whole 2 months or a month and a half, you're literally learning these skills. You are being taught by a professor about the things that they will test you on. After your exam, you're pretty much gonna be training with a circulator in whichever department that they decide to put you in, wherever a circulator is needed the most. And once you are assigned to a nurse, then you stay with them for as long as you need to, or as long as your pod requires you to stay and train. And so I trained for about 2 months. I was training, and I basically was observing and leading, being hands-on with different surgeons, because every surgeon has their own perks. They have certain things that they like, certain meds that they use. So it's good to know these things for each procedure. And it is highly recommended to have a little notebook. I got this from Walmart, just a small size notebook that you can fit in your pocket. And it basically has each surgeon, the procedure, and what they require for each procedure. So what position is the patient going to be in, and what medication are they going to use, what kind of equipment needs to be in the room, and when we're closing that incision site, what kind of dressings are they going to need. So all these things I have in my little notebook. Once you're off of training, then you're basically on your own as a circulator. Now, one thing about being a circulator is that you are taking care of patients one at a time. You are not rushing to, get multiple patients. Like, you usually in a room, and then there's another room that you're tag teaming with. So once the surgeon is done in one room, then they will send for the next room. Usually there's different surgeons who like to move fast, so they will send for their next patient early. And there's surgeons who would wait until they're close to closing the incision until they send, because they want to be there for the process of positioning the patient and everything. So it all depends on what your surgeon prefers. As a circulator, you are not really using a lot of nursing skills. I would say the main nursing skill that I use from nursing school is probably inserting a Foley. Now, every now and then I put in an IV, and that's usually because I ask the anesthesiologist, like, hey, is it okay for me to try if that patient needs another IV? Otherwise, it's a lot about positioning, a lot about maintaining sterility, and just gaining trust from your surgeon, from your employees, because you are working alongside a team. So you have to be a team player when you a circulator. And I personally am still developing my skills to be confident, because there are times that you really have to be observant and watch out, be the extra eye. So make sure there's nothing going onto your sterile field without you knowing. And whatever is going into the sterile field, the circulator should be there, opening it, verifying it with the scrub tech. And if y'all want me to talk more about sterility, I most definitely can. But it's very important that you maintain a trust, and that everyone in the room can trust that you can do your job, and that you will do whatever you can for the safety of your patient. And that's how everyone in the room should be, not just the circulator. But the circulator's job is mainly managing the operating room. So if they need an extra tool, or if they need an extra instrument, you need to be ready to go and get that. And it's also important to know where everything is within your area. That way, when they ask for something, you know how to quickly grab it. They won't take a long time waiting for you to grab it. So all these things that you learn during training, where things are, what your role is as a circulator, what you do as a circulator, you basically learn these things as you go. And once you're on your own, you begin to create your own routine to see what best works for you. That is basically the gist of being a circulator. It is not a stressful job. It is definitely less stressful than med-surg. I've worked in med-surg, and I will take this position that I'm in any day. So this is a very well maintained job. You're basically listening out, you're looking out, and there's not much charting. So majority of our cases are at least an hour for our spine cases. I think the longest case I've done has been 4 hours. Everyone basically trusts you to play your part. If y'all have any questions down below about a circulator, I am more than happy to answer them. I've been doing this since August of last year, so I'm about to hit a year, but so far I'm loving it and I am still learning. All right, thank you so much for watching, and I hope y'all have a good day. Till next time.